I'm May, and I'm joined by my co-host Yakira Eden, and we have a guest host today, Mr. Lane Rasberry. And Mr. Rasberry, no P, Mr. Rasberry joins us as a Wikimedia in residence at the School of Data Science at the University of Virginia. And we are going to be talking about some really important things, and that's how we look at health information online. How does what we search when we get a diagnosis from the doctor, or maybe we need to look up a particular study, how does what we search end up in front of our faces? I think we all know that a word algorithm, but there are people, not just bots, but there are also people behind how that happens. So Lane is going to kind of take us through some of that, and let us know like what he does and how that affects what we see when we put in our search in the Googles. So Lane, tell us a little bit about what you do as a data scientist and Wikimedian. I guess maybe explain what a Wikimedian is.
Uh, Thanks for having me. So I'm at a university, a very conventional university. Many universities are teaching classes in data science. This is a fairly new field of research. And what data science means is that, like you were saying, it has to do with bots, but every bot is operated by a human. And there's a lot of human judgments that goes into this. Never think that the bots are unbiased or can make decisions by themselves. So when there's large data sets, like for example, someone searching for information online, a human can't sort that out. We can't just use librarians to present all this information every time someone makes a search. We're past those days. We use a mix of librarians operating bots and just humans making decisions to present what people find. Now, there's companies like Google, they're running search and they're doing magic. They have computation, they have resources that a university would never have. I work with Wikipedia, so I'm at a university, but I work with Wikipedia. And Wikipedia uses automation also, and it is a rather big website. But there's different ways where humans are editing Wikipedia, using search in all kinds of ways, and using algorithms in all kinds of ways to make sure that people present better information. So the Wikipedia that everyone's familiar with, it's an encyclopedia, a general reference resource. It's got a lot of health articles, for example, and it's mostly volunteers who are editing this content. These volunteers, they go out into the world, they find sources, they put them into Wikipedia. There's something else that's happening, something that's new that many people haven't caught up with on Wikipedia. There's something called Wikidata. So associated with the Wikipedia that humans read, there's a collection of structured data that supports Wikipedia. It's intimately connected. It's in the same platform, but it's structuring the data in Wikipedia, and it's changing how people find different information elsewhere. So the major search engines like Google, they do index Wikipedia and present that, but all kinds of other researchers, not just Google, but university research as well, they do things with the data sets in Wikidata. They use that for other purposes. And the point of all of this is to help somebody better find information that they're looking for and make information circulate more freely when people need it.
I have a question.
Sure, of course, I'm sure you do.
So you're at the university, you're at UVA.
Yes.
Are there other Wikimedians in residence or Wikimedians and I don't know, would it be fair to say content creators, or is it different?
You can say content creators. That's the best analogy for what I do. So if you imagine my relationship with Wikipedia, so there's YouTube, and on YouTube there's YouTubers. And the YouTubers on YouTube, they're not employed by YouTube. Anyone is a content creator. They can just post their own content. Okay. And there's at the university, every university, they employ somebody to manage a Twitter account, manage social media accounts. Mm-hmm. And those are kind of content creators. Those people are not employed by Twitter. The university has to employ their own social media professional to post to Twitter. And you could say that I'm the person who manages Wikipedia content at my university. I'm not employed by Wikipedia. I'm a social media content creator. It just happens that Wikipedia better aligns itself with academic research than Twitter. So the person who's doing Twitter for the university, they only do communications. They're not necessarily associated with people's research. And it just happens that Wikipedia's got a lot of information that researchers at the university might want. There are other people like me, but being a professional Wikipedian, it's still much, much less common than being a social media professional.
Right. Go ahead.
Oh, sure.
We
Thank you.
probably have the same questions.
So, can you tell us a little bit about how you prepare information, or how you verify information that is shared? Yeah.
Sure. So I happen to be, I do it with a community. That's one answer. So there's a group of people who talk over social and ethical issues, quality issues, and it's actually multiple communities. So one of the there's a community in Wikipedia, and these communities in Wikipedia, they're called wiki projects. There's a wiki project for every subject you can think of. So there's wiki projects for sports, wiki projects for literature, academic subjects, history, economics, whatever you may think of. Professional wiki projects. So there's wiki projects for law, and the one that governs health and medicine is Wiki Project Medicine. So one answer to your question, how does anyone decide what to do? You talk with the people at Wiki Project Medicine, and you ask them what level of quality and fact checking do we want in Wikipedia? We have to be reasonable, and we have to match the content to the audience, because if you're too precise, then it's good for doctors, but then typical people can't read it. So you have to lower the precision to try to match the readership of Wikipedia. But then I collaborate with other communities. So, for example, I do work with health communication experts, typically on the academic journal side of things. So we ask people who publish scholarly research, what do you think is appropriate for Wikipedia? And then get their information. And then a third group that we work with from time to time is we get public health professionals. So these are people, typically they have the simplest messaging because they're trying to reach the broadest audience. And often they don't drop citations and links to the medical and academic research. So they're not sharing all the information, but they do identify what are the most important health messages we need to get out to the most people. And that's why you need public health communication professionals. So we get multiple perspectives from all the people that you might expect would have a stake in health communication.
So how is it determined? Like, so let's say Lane Rasberry is submitting an entry or contributing to a Wikipedia article or page.
Yes.
What makes what you find more important, or the piece that gets accepted or put in versus a Wikimedian somewhere else who's another volunteer or content creator?
Sure. Let me say something about the Wikipedia editorial process. So Wikipedia has been around since 2001, ancient in internet terms.
Right.
But the fundamentals were in place from the beginning, and the philosophy of Wikipedia has not changed in all that time. Wikipedia is a general reference encyclopedia, and anyone can edit it. So if I were to add content to Wikipedia, 30 seconds later, somebody else could remove it if they wish to do that. Anyone can edit any Wikipedia article at any time. That's not to say that Wikipedia is an anarchy. That doesn't mean that anyone can go in and there's no rules to things. There are, in fact, rules. Wikipedia is also not a democracy. People don't vote on these things. So we have processes in place. And when I add things, because Wikipedia is digitally native, it's a computer platform. And anytime someone edits a health article, the robot sends out alerts to other people to double check everything that's done. Okay, I'm going to briefly explain the quality control process on Wikipedia. So this is how it goes. This is how you vet out somebody who's fooling around versus somebody who's doing what they're supposed to be doing. Anytime someone adds a sentence or a claim to Wikipedia, that's not supposed to be information out of their head. That's not supposed to be a personal opinion. We don't know who these people are. So the way that we do quality control in Wikipedia is with fact checking to reliable sources that people cite. There's different standards in different fields. So for example, if you're editing Wikipedia articles about celebrities, their biographies, then in those circumstances, it's okay to cite tabloids.
Right.
But if you're dealing with medical information, we have standards for what reliable sources are. And the highest standard we have are peer-reviewed academic publications, systematic reviews. That's really what we're looking at.
Right.
Some cases will make exceptions, like during the COVID pandemic, we didn't always have peer-reviewed publications to cite. And in those cases, we would look to expert organizations and pull out their public health messaging. Sometimes they couldn't back that entirely with research.
Mm-hmm.
If it was coming from an expert organization, there's times when we make exceptions. But the standard is always, what is the most recent medical research that has reviewed many other papers and has consensus from all the medical professionals? That's what we want to cite. And if
Right.
enough content gets into Wikipedia, then if somebody were to remove it immediately, then people who don't know what's going on or don't understand the medicine, what they're going to say is, I'm going to put that back because I see that somebody cited a reputable journal. And even though I don't know this field, and even though I don't know this journal, I can see that this is peer-reviewed, systematic review, and that's the kind of thing we want in Wikipedia. And if somebody's going to remove that, they better have an explanation. And if they don't have an explanation, we're going to put it back until someone talks through why they're removing this content.
Right.
So that's the basic editorial process.
Good thing.
Could you tell us a bit about how someone would, take the opportunity to get into the field of Wikimedia, whether it's, taking a lead role as you are, or even, starting out perhaps as one of the people that you describe who are working with and, perhaps it's not just the fact checking, but if you can share a bit about how someone would get into this career path.
I can tell you a bit about my career path, but I wouldn't recommend this broadly to others. So if somebody likes the things that I'm doing and they actually want to get paid and have a stable career, I would recommend that you go into public health communication in different directions. You can go in social media, learn about Twitter, learn about YouTube. You can learn about website design. You can work with public health agencies and start learning simple English and plain language. How do you take technical concepts out of academic journals and learn to rewrite those for different audiences? So if you're speaking, there's different levels of plain English. Do you want a fourth grade level for native English speakers? Do you want something that's a little more precise? You're going to drop some technical terms from time to time. And under what circumstances do you do that? And how do you manage technical language that not everyone's going to be familiar with? Do you want to speak to more diverse audiences? Do you want to speak with non-native English speakers instead of native English speakers? Because you're publishing online. And if you're going to publish to a website or to Twitter, all kinds of people are going to read it. And you need to learn these things. So if somebody's interested in what I'm doing, I would say, please don't start with Wikipedia. There's other skill sets that you can develop in communication and basic social media management. And if you learn those things and then you're interested in Wikipedia, then wherever you get your job, you can say, I can do all these things. Plus also I have some Wikipedia skills, and maybe incorporate a part-time Wikipedia engagement program into your broader job that's publishing in many places.
I have a follow-up question. This is so interesting.
Sure.
So let's say someone, so we came from the perspective of, doing this as a career.
Yes,
but
yes.
if I am a small business owner and I want to establish my presence as an expert in a particular field,
Yep.
this is very well something that I could explore and take on and begin to just establish some grounds by writing and presenting information, essentially.
Yes.
Okay, nice.
I mean, it could be done. It's nearly unprecedented. Just about every expert in the field, where they'll start to build their presence, where the easiest win is developing a social media presence, and that means the basics. Do you have a Twitter account? What does your LinkedIn look like? Do you have your own website? And then maybe you could do something like set up a YouTube channel and start interviewing people. People look for these kinds of things as well. For Wikipedia. It's just a bit of a longer learning curve than any of those things. And I'll tell you why briefly. So the reason why is YouTube, it comes from Google. Google is a multi-billion-dollar entity. Twitter, they're not quite that rich, but they are very, very well established. LinkedIn, it's associated with Microsoft. They've got good software developers. This is the truth. Wikipedia is a nonprofit project. There is not a big corporation behind it. And I'm telling you truly, Wikipedia is software from the 1990s. It is unfamiliar to many people. And if you really want to learn some of this, you can, but it's unlike any experience that anyone has in other websites that are backed by a corporation. It's a bit clunkier, and you see a lot more code on the screen to edit Wikipedia. And that's one of the reasons why fewer people engage with Wikipedia than these other platforms.
I
Yeah.
see. Thank you.
I think once, because I've seen, so this is not necessarily regarding health information, but just in general, how Wikipedia works. Like, and this is why this is so important, because it's like, I think we've all had that experience where we researched something and found like a shocking Wikipedia article and then found out it wasn't true. Like I've seen, like they've killed whole celebrities on Wikipedia, and they had the obituary and everything. And it's like, what? And I think once I tried, I was like, well, how can you contribute to something if you found information and you're ready to cite it. And you're right. When I went in, it was like so not user friendly. Like it wasn't. It was like I'm just looking for radio buttons and drop down boxes. Like I'll type in what I want to type, but then after that, just ask me the questions and I can select yes or no. And it is very archaic with how things get entered. Like, why haven't they shifted that?
Yeah. Why haven't they shifted that? It's very expensive, so that's the simplest reason why. Also, the nature of Wikipedia, part of its success is the philosophy of sharing information for free without advertising, being independent of corporations. And when
Mm,
you do these kind of things, you just don't have much of a revenue stream.
right.
So not only is Wikipedia underdeveloped, but also it doesn't have so much income coming in to improve these kinds of software. Also, part of the philosophy of Wikipedia is so many websites, depending on what country you're in, you get a different experience in the website. It's targeted to you by country. Websites also spy on you in many other ways. They come to know your age, your demographic, how much money you make in some roundabout way. They're selling advertisements to you, and they're tracking you in different ways to sell your data to other people. Wikipedia doesn't do any of these things. If you go to a Wikipedia article, no matter what country you're in or no matter who you are, you see the same Wikipedia article as everyone else in the world. So it doesn't change depending on who you are or where you are. And for these reasons, Wikipedia is not attractive to the kind of companies and marketers that want to target people with advertising or influence them in particular ways. Wikipedia is not for sale. It's not for influence by marketers. And because of this, it's not as if Wikipedia is competing with other people trying to present this kind of encyclopedia. Part of the reason why Wikipedia has been successful is that there's nobody else that would conceivably fund this kind of project. Like there's no one trying to share general reference information with no advertising because there's no money in this.
Mhm.
So that's one of the reasons why Wikipedia can survive with low technology and still be very popular among many people because it's like a public park. And
Yeah.
no one really makes money on the public park. Everyone enjoys it, but you don't make money off of it.
Yeah. So that made me think of another question. Regarding like how it's used, like all of the different, excuse all the different
Uh-huh.
buzzes and books, how everybody uses Wikipedia. So I'm going to use that like to move into like the algorithm. How is
Uh-huh.
it, what you do as a data scientist, like
Yeah.
as your, like how do how does that influence what comes up first? Because I don't know about anyone else. Like anytime I look up anything regarding, like, of course, history, but even if it's a health article, the first, and we know there's, SEO, which is search engine optimization, all of that. Um, Wikipedia is the first option. Almost 99 out of 100 times, Wikipedia is always the first option. So
Yeah.
can you talk us through like how that works and how that happens and how we can, maybe we don't want to use Wikipedia. Maybe we're looking specifically for, an article that was written, or, a scholarly article or news article, and how you would, help people kind of move through that, like not getting stuck in that first option.
Yeah. So there's no promises with Wikipedia because Wikipedia does not have a relationship with the search engines, or it's not a public relationship, or it's not a very well understood relationship. I can tell you. So Wikipedia was established in 2001, as I mentioned. Google was established in 1999, so 2 years before Wikipedia. And even in 2001, within months of Wikipedia coming to existence, if there was a Wikipedia article for a topic and then someone was searching for that topic in Google, then Google would preferentially put the Wikipedia article at the top of the Google search results. There's nobody at Google that entered a partnership with Wikipedia or made any kind of commitment to say that Google is going to give people Wikipedia articles when they exist. However, it's been more than 20 years, and consistently every year, Google has been delivering Wikipedia articles to people when there's a Wikipedia article that exists for what people are searching for. And not only Google, other search engines as well, Bing, DuckDuckGo, and things that people don't even know are a search engine. If you have an iPhone and you're talking with Siri and you ask Siri a question, Siri doesn't tell you where she's getting her information, but if that information is available in a Wikipedia article, she will read you the Wikipedia article, or send you data out of that Wikipedia article.
Mhm.
Amazon runs a service called Alexa.
Oh my
And
gosh, you're gonna activate her. She's nosy.
It's like, don't say it.
she,
Don't say
she,
the name.
she's all in Wikipedia as well.
Yes. No,
Yes.
it says
So,
here's
Okay.
from Jen.
so the reason for this is that part of Wikipedia's philosophy is being free and open. So anyone can do whatever they want with the text in it, the images in it, the data from it. And so if you have developers who are putting together a search engine, they can either pay a company a lot of money to license data and content, or they can just pull it out for free from Wikipedia. And
Right.
since Wikipedia is high enough quality and it's got that good price point free, then there's so many search engines that preferentially point to Wikipedia. What this means for people. So what if you want other options, not Wikipedia? Well, you're just going the typical user. All kinds of people preferentially just take whatever's first. Like the first page of a search engine results page, that's the most popular page by far. There's very few people that click the page two. If somebody's more savvy or they're looking for particular kind of information, they might go on to page two. But if you're thinking about this enough to think maybe I'd go on to page two, then you can think about this enough to think, what kind of information do I really want and where are the sources for this?
Mm-hmm.
So the person who wants to read, who's thinking of a medical topic and then they want more particular medical information, I would say familiarize yourself with the major uh, public health communication websites. So, like the Centers for Disease Control, or you can look at the UK and look for their National Health Service website. You can look at the World Health Organization's website. So those I would not call scientifically robust, but they're designed to communicate health issues, and they are backed by some science. And then if you actually want the science for medicine, there's no place else to go. You've got to go in the academic journals, and they're indexed in PubMed. So you have to learn how to do a search within PubMed, run by the National Institutes of Health, the U.S. government.
Mm-hmm. Right.
So I know we've been speaking a lot about Wikipedia and articles in particular, but I know that there is an actual Wikimedia component and there are projects that fall under that. Could you share a bit about what those projects are and how those are, how those resources are made available to the public? Because they go a bit deeper than just articles.
They do, yeah. So Wikipedia is the familiar general reference encyclopedia. This is what people read. And Wikipedia is part of an ecosystem of different projects. So there's a community of people who are developing Wikipedia. There's related communities. These all interact. So it's one major website that points to other parts of the website in a web or a network. And I'll say one of the points. One of the points I mentioned already, Wikidata. So Wikidata is converting the facts in Wikipedia to structured data. And the point of Wikidata is so that robots can read it. Wikipedia is for humans to read, and Wikidata is for robots to read. So by and by, as we're converting these things, if we're expecting a robot to come into the website, take information, and deliver it somewhere else, and people try to convert that to structured data in Wikidata to make it as easy as possible for the robot to read. Something that's more familiar and easier to explain is the Wikimedia Commons, which is the non-text media repository. Supposing, so images, for example, supposing we have a picture of a skin condition, and it's possible to look at that and say, okay, this person's got a skin condition. We want that as an illustration in the Wikipedia article for that condition. And Wikipedia exists in multiple languages. There's about 100 languages that are very well developed. And if you have the skin condition and you're in the United States versus Argentina versus India or wherever else, you might read this content in different languages, but the skin condition could be the same. You could show the same images across languages. And if you're talking about things like medical procedures, you could show the medical devices or the medical imaging equipment or whatever the case may be. That translates very well. So people will curate these images, means you got to either get a photographer, sort out the licensing, decide whether you want to crop the photo. And the people who can do photo manipulation, they don't necessarily need the skill set for editing encyclopedia articles. Maybe they only care about manipulating photos or collecting photos. So you have this photo curation community and then the article editing community. And when a Wikipedia editor of the text needs a photo, they go to the photo community and say, hey guys, can you work with me? I'm trying to find a photo to illustrate this article. What can you give me? And then they'll provide something. And other things that can happen, people could say, we'd like photos from our community. So if you have hospitals in the United States, they may look different than hospitals in South America or Africa or South Asia or East Asia. And so people want to see content that's locally relevant to them. And so we need these different images to explain what's different about medical care in different places. There is some variation from one place to another. And so the photo curation, it's not trivial. You can't just label something by the condition. You need geographical data and time data because things change over time, and these other kinds of library cataloging identifiers for what photos are appropriate for what time and place. Wikimedia projects, photos, data, and the encyclopedia.
Okay.
Yeah.
That's really interesting. There was another question that I had.
Sure.
Regarding, I think it kind of goes back to who's putting. It goes back to the idea of who's putting, right? So it comes to, like, you said, if there is something that you're really looking for, because I have ended up on the fourth O in Google, down at the bottom, because I'm like, and then after the fifth O, it's like, all right, maybe change the search term to something, because whatever you're looking for is not coming up. If you're going to the CDC, World Health Organization, they also have Wikipedia pages. So managing that.
Typically not them. So you might be surprised. There's a lot of organizations. CDC goes through many billions of dollars a year. It's a very large organization. They definitely have people managing their social media accounts.
Yes.
There are a couple of people at the CDC who are employed to do Wikipedia, but it's not as many as you would expect, and they're not managing the Wikipedia article for the CDC. It's such a massive organization. They're doing so much research in so many areas. I wouldn't say the Wikipedia article about the organization does it justice. I'm at the University of Virginia. I do not edit the Wikipedia article for the University of Virginia. So I don't do marketing. I don't do branding. I'm not editing the biographies of scientists. I'm taking research knowledge from the university and putting it into Wikipedia. And it's not always obvious that ever came from my university. So we're not getting a marketing kick out of this. It's really just about sharing knowledge that researchers want to distribute. You can't get money out of this. You can't get links back or these kinds of things. And it's the same way with CDC. It happens for a few reasons. One, Wikipedia doesn't encourage this behavior. In fact, we discourage marketing and branding. We tell organizations, you're welcome to share your knowledge, but we really don't want you promoting yourself in your own article. And so the stand that a lot of organizations have taken is that they just don't touch their articles at all. They just say ignore it. If you want to know about us, you come to our own website. There's other things you could ask, like who's editing Wikipedia articles at all. It's very hit or miss. So in CDC, if for those departments, and there's many departments in CDC, there's so many things that you could say about public health. And the departments that contribute to Wikipedia are the departments that, for whatever reason, have people who feel like contributing to Wikipedia. That might be obvious to you, but like there's parts of CDC that have YouTube channels, and certain content gets published on YouTube. But if you don't have someone who wants to get on the camera and talk, then what do you know? There's not going to be any YouTube videos.
Right.
There's these kinds of biases all the time, and it's not evident where they're going to appear or who's going to be represented. We can start to track who's being represented. I guess the most clear bias I could say is if you've got more money, you're more likely to be represented. But we could get more subtle than that about who gets represented in Wikipedia and who doesn't.
And who doesn't? Yeah, that's something interesting to even talk about. Like, what is the demographic of Wikimedians? Like, I think like as we were prepping for this, I was looking like, okay, well, where are the melanated Wikimedians? Like, are there any, people who identify as Black, American, or African, or people from other countries who just are melanin dominant? And there's not that many. Can
You're
you talk
correct.
about
Yeah,
that?
I can speak to that. So this has been a heavy discussion for as long as we've had money. I can say that much. And as we're dividing up resources, people are talking about Wikipedia does a donation drive. People are asked, "Can you donate to Wikipedia?" This money comes into a pool, and the idea is that the community negotiates to send that money out in different directions. And when we have biases, and I don't have all the data, and I can't say it. But what I would like to say is if we do have a deficiency in a demographic, then that's the way it is. But we correct that by sending money to that demographic. And everybody in the Wiki community wants underserved communities and underrepresented communities to be overrepresented in receiving money. So that's the general plan for fixing these kinds of things. Wikipedia started in the United States. The demographics that we have right now, 90% male among editors. 90% male. That's one thing. Heavily represented in the Western world. I don't know the proportion, but throw out a number, 60, 70%.
We don't have to. We just
English language is heavy.
Mhm.
And just about every editor that is connected to the international community, like if you're joining the global conversation about who gets money, how are we going to correct the problems, what do we do for quality control, how do we manage the governance of the Wikimedia movement, they do this through English language. That is, some people do it through French. Like there's many people in Africa that don't speak English. They negotiate with the French community. But if you're negotiating with the French community, you go through the country of France and you go through Montreal and you go through the other countries in Africa, the former colonies. So I don't speak French. I know that this community exists. I know that there's hundreds of people engaged in French language governance decisions. And let me clarify. So the user base of Wikipedia is also writing the rules for Wikipedia. There's no leader or authority or owner of Wikipedia who's telling everybody what to do. It's the users negotiating among each other for what the standard should be. We've poured money for, like I said, about 10 years into trying to correct minority underrepresentation. And I'll just give the opinion that even giving money hasn't solved the problem. Perhaps more money would solve the problem, or perhaps we need to do something different. I'm not sure what the case is, but there's grants available. And if you know interested health communities, they can always apply for grants through the Wikimedia grants process. And there's a lot of favoritism and preference given to more modest, lower quality proposals from less prepared people if they're in an underrepresented community. So anyone in South America, anyone in Africa, anyone in Central Asia, when they apply, if they can make a modest proposal to do something, then it's very easy for them to get $5,000 or $10,000 with almost no credentials. If they do good with that money, let's step
Mhm.
it up to $20,000, $30,000. If you can show your receipts and have a little outcome with that $30,000, let's get you up to $100,000 a year and start funding you. So
Mm.
that's the direction that the community is going in.
Mm.
So, this is really, really exciting and informative. I think those are the two, and yeah, it's like really exciting. Yes. Because when I think about True Health Live and what the focus and mission is, we're always interested in making sure that folks are informed about how they should move forward. And we speak so much about research and advocating for oneself and sharing information. And so I think what I'm hearing you share, from one perspective is, number one, the information that's made available through Wikipedia, uh, to some degree, is reliable, in that you can look at the references and do your own research and fact checking before just taking the article blindly. So that's one piece. So you've offered some tools as to how to dig a bit deeper.
Mhm.
Also, even appreciating the fact that it is such an open system really speaks to the value, in number one, contributing to, but also finding ways to, contributing financially, but also contributing by way of ensuring that information, for those of us that are experts in a particular field, that we're sharing information there, because that's a great way to get it to more people, right? And I like that it encourages it, each process owner to not self promote, because then it just really reinforces the mission. And to some degree, you can even appreciate why Wikipedia is publicly vilified, right? It's precisely not what big business wants us to be
I,
all about, right? So I guess that's what I'm saying. It's like informative and exciting, because I'm learning so much about how different yet large Wikipedia is, and how firmly it stands on its mission.
Yeah. I just want to say, like Naya in the chat, she said she saw a message on Wikipedia today asking for donations, and we see them periodically. And now I feel really bad sometimes for like Xing out and like, I'm looking for something, and I try to like move fast. But I think, one thing that I think, based on what you said, it reminds me of like the idea of community. Everyone is contributing so that we all get something back. And so that being said, I think like a good way to contribute, even if it's like, okay, well, I don't have it right now. And I'm talking not to myself, but to everyone. It's like, if you are a public health expert or any kind of expert in your field and you have information, like, then contribute. That's, reciprocity. If you're pulling information off platform and you have the wherewithal and the knowledge, right? Knowledge, wisdom, and understanding to be able to put something back in there, then do it. And especially if you're melanin dominant, because as we heard today, there's not many people that look, like me or like Precious, that are doing this. And I thank you, Lane, for even, sharing that, especially like with the grants, because I'm like, so what does that even look like? So like, do you have an idea of like an example of what a Wikipedia grant looks like? Like, what are the deliverables?
Sure. Um, I've helped a lot of people write grants. I'm a wiki community organizer. Besides these things, my funding is not from the Wikimedia Foundation, but I've supported other people in getting these fundings, and I do grant writing at my university, so I can't speak to this. First, I'm going to say something about Wikipedia donations. They do ask for money. You're hearing this from me. I'll just tell you. So if you give this money, if you give $3 to Wikipedia, then that money goes to the Wikimedia Foundation, and then by and by it goes back down to community. And where the money always starts is getting people to sit down and talk with each other, buying coffee for people. So if you don't exactly have money to donate for Wikipedia, here's how you can donate. Buy a cup of coffee for your own friend who's going to sit with you in person in your own community. and talk about whatever is important to you, whether that's health information or anything else. And if you want to make that Wikipedia related, look at a Wikipedia article together and ask yourself the question, what is important to me that's not in this Wikipedia article? And start to think about what is the bias in media against you and your demographic. So if we're looking at health information, like I said, the content in Wikipedia, it kind of follows money elsewhere. And where the money is in health is in the pharma industry. So a lot of Wikipedia articles, they're biased to present drug-based solutions and medicalized solutions for everything. So any Wikipedia article, they're not presenting a nursing perspective. They're not presenting a counseling or mental health perspective because there's no money in that. They're not presenting a fitness or nutrition or exercise or physical therapy perspective because again, there's no way to mass market physical therapy and general health in these kinds of ways. And so every Wikipedia article that you look at, there's serious deficiencies in it about who's not represented. And another kind of deficiency, this is a heck of a problem. But if you take any medical condition that you want to talk about, or even any drug or any procedure, we have one Wikipedia article for that. But if you consider a medical condition globally versus a medical condition locally, often if you just look at it by country, there's very different ways of treating or experiencing medical conditions. And whereas in one country, maybe you need a drug intervention, for another country, maybe there's something else about the condition where you could use a lot lighter intervention. Change something about your diet or change something about your fitness. Wikipedia does not represent that at all. Now, to fix that, we could change things like we have an article called diabetes. But what if you change that to diabetes in the United States versus diabetes in Mexico versus diabetes in India? It would be a different article. And currently, we don't have enough editors to maintain one article for every country, for every disease. You're multiplying everything by a couple of hundred. But that's one of the biases in Wikipedia. You're not necessarily getting the information that you need for your own community. Now, about these grants, if there's a community that can actually get a few people together, meaning like 3 to 5 who are in alignment with each other and say, hey, we're looking at this Wikipedia content and we want to have conversations with each other to correct it or address it for our community. You can do this in English language. You can do this in any language that you want to. Like I said, priority goes, the people go to the front of the line if they're from a minority or underserved community, and also if they're from an underserved language. You can totally do this with English. You can totally do this in the United States. Like, it's available. But just, we are looking at the global picture for this. And what the grants process is going to ask is, what are you guys looking? How many people do you have on your team? Can you start modestly and propose a pilot that you want to do? And we start the grants at $2,000. If anyone asks $2,000 and they have an okay idea, they're quite welcome to come into Wikipedia. You're almost certain to get that money, because anyone who has that kind of idea and wants that money, it's not what the point of giving away $2,000 is to see, are you really interested in developing Wikipedia content, and do you have the capacity to do this? And if anyone can get $2,000 and they do okay, then you're immediately eligible for more money to do more things. In the United States, you were asking about African diaspora. We have a few groups that do this. So there's a group called Afro Crowd. They mostly do cultural interventions. They do some health interventions, and they're dealing with the African diaspora more broadly. This is kind of problematic because if you're African American versus Afro-Caribbean versus an immigrant from Africa, there's nothing in common. Like, so many differences between the different communities. But such as it is, people want one entry point, and Afro Crowd's the entry point. There's another group that deals with African Americans specifically. It's called Black Lunch Table. And again, it's this idea of people getting together, eating lunch, talking about what your problems are. They apply for grants. They support people with getting grants. More specifically, there's regional African groups. There's it's called Wiki Caribbean. So for anyone who's associated with one of the islands, whether you're from there or you're living in the United States these days, but have some heritage there, some awareness of this, they support people in applying for grants. And then wiki communities for just about every country in the world where the communities try to support people. I'm not going to say these are the most developed. They're not the most, these are peer-to-peer support communities. So don't expect secretaries to get back to you in a lot of administrative structure, but such as it is, they're supportive communities, and they want to help people get connected to resources, including actual grant money, to do these kinds of things in alignment with the Wikipedia mission.
So if I was just a regular Joe Schmo and I listened to, or Jane Schmo, and I listened to this episode of True Health Live, and I didn't know where to find, Black Lunch Table or Afro Carry, what would I do? Like, what are the simple steps that I would have to take to apply, to like find the grant applications and then apply?
Something different about Wikipedia as compared to other websites is that you can talk to what you could say customer service. There actually is no customer service. We don't have staff that are answering questions, but we do have a community. So you can go absolutely anywhere on Wikipedia. You can be completely clueless. You can go to the Wikipedia article for the president and then click edit. Don't do this, and just say, help me, I'm trying to find something, like right in the middle of the article. Don't do that. It's vandalism. But if you were to do that, then someone would very politely say, you're in the wrong place, but let me guide you and direct you. Actually, what you need to do is look for help on Wikipedia and then ask a question in the help forum. You do not need, there's so many help forums, there's hundreds of them. You do not need to find the correct one. Ask him whichever one you find. Just briefly give a couple of sentences, say, I want to talk to somebody about such and such. They'll refer you to the appropriate health forum or help forum. There's humans on Wikipedia, and you can do this in any language, like whatever, wherever, and however, and in whatever way you ask the question, somebody's going to help you. And then if you wanted a path to grant funding, and I'm not going to say start at grant funding, you should start with making your first edits in Wikipedia. But you say, I'm interested in such and such a topic. How do I get started? You can read the tutorials and manuals, but I would say as soon as possible, start asking questions and get a human to help you with things. Because again, this isn't like other websites. It's a peer-to-peer support service. And the sooner you know how to ask questions and get help from a real human, the easier your time's going to be.
Thank you so much. You're welcome, Nayish. Nayish says this is so interesting and informative. Thank you for sharing. I'm also like I'm like sitting over here like, because I was not necessarily expecting like all this gold mine. I was like, we're just going to talk about like how people search for health information. We've gotten so much, so I have to say thank you so much for sharing, your knowledge and providing that, because it'll be able to help a lot of people. I'm probably you probably are now sitting with two new Wikimedia interests.
Indeed.
I'm like,
Indeed.
all right, I'm gonna be putting some things on Wikipedia.
But also just thinking about the value of going in and editing and updating, just because we each have a base of knowledge. And so if I go in and I look at articles on mental health or mental health or leadership, I have a particular perspective, and I'll know, no, that's actually not accurate, which has happened. And so now it's like encouraging us to go in and make those changes and to contribute to the community in that way is just really impactful. Like, thank you.
Yeah.
That's the point of it. It's satisfying to me. I'm glad you find it appealing also.
Yeah. The other part is like I'm so glad that you shared about like the bias on like what solutions are offered. Like when it comes to health articles, they really guides people toward that allopathic or like pharmaceutical track. And it's like maybe certain communities, they're looking for what are like some herbal or homeopathic remedies. And so and as you said, like it's always like it's where the money is, right? And so there's not necessarily a lot of money in more holistic research. There are studies and there are people doing that, but it doesn't get the same amount of funding and endowments as like the lab and the science, like the chemicals and the medicine. So like if there's not a knowledge base out there, that's what needs to be added and included so that people can see like a well-rounded picture of all their options. Like we've been having conversations on multiple platforms about reproductive health for women, and how certain communities, especially when it comes to melanin dominant women, like they suffer from sexual and reproductive health issues more than their counterparts from other ethnicities. And there needs and a lot of that issue is because they weren't aware of what their options are when they're
Yeah.
diagnosed with something. So if there's a way to like put all these, this information, especially if Wikipedia is the first thing that comes up when you do a search, they'll get that information right at the front door.
That's the idea. That's a big part of the reason why I contribute to Wikipedia, because if nobody was reading this, I might as well be putting it on my own website. But if you put it on the reason not to put it on your own website is because if you put content on your own website, then you have to also drive traffic to your website.
Yeah.
If you put the content on Wikipedia, you're making different compromises, but the big benefit that you get is distribution and dissemination. You
Yeah.
get at the top of search engines for free if you're sharing this kind of general interest information.
Yeah. Thank you so much. Oh my goodness. Is there anything else like because I'm like I got lost in some things. So is there anything else that you that maybe we didn't go over that you want to share regarding like looking up health information? I think we got, you can apply for grants. The first thing that we should do is like start editing on Wikipedia. And then you can look into the grants. So I guess in order, start editing, then you can look for grants, then like find a community that's maybe even able to help you apply for those grants. If you're interested in starting this, like refer to step one, start entering in information.
Yeah.
um
Here, I'll go through in order. So if somebody's new to Wikipedia and you want to edit health information or whatever kind of information you do, so first, don't go to Wikipedia. You should go to the library or go to a reputable information source. And for whatever topic you care about, whether this is a book or a research paper, whatever the case, find the best source of that information in the world that you can find. And when you have that source, pull a couple of facts out of it and think, I'd like to share these facts more broadly. And when you have your facts, then it's time to go to Wikipedia and find an article where you can put, if it's one sentence, that's fine. If you want to put a few sentences, that's a great start. 3 sentences is a great start. And figure out, there's an edit button on the Wikipedia article. Click that edit button and figure out how to add one sentence and cite your source, because that's the building block of Wikipedia, this match of a fact with a citation. Because if there's no citation, the wiki community can't do fact checking, they can't do quality control. So if you understand how to add one sentence and one citation to Wikipedia, then if you just do that 10 million times, you've got the whole encyclopedia. But that's like what you need to learn. This is how you add facts and encyclopedias. After you've done that, then step two should be go somewhere on Wikipedia and ask for help, like look for help and say, I've added a sentence and a fact in Wikipedia. Can somebody look at what I did and tell me if I've done it right? And you'll have this social exchange with that person. They'll verify, they'll give you some feedback about what you did. And then after you've done that, tell them more about what you're interested in, and they'll send you to a community. If you're interested in health, maybe you should go just say hello to the health community and look at what other people are talking about. Consider whether you want to join one of those conversations or collaborate to edit with somebody else. Or maybe you're using Wikipedia for recreation. You do health, but maybe you really want to talk about music or movies or sports or anything else. That's fine too. You don't need to learn Wikipedia doing something that's complicated. If you're a health professional, maybe you want to do something else in your off time, and you go to one of these other communities and you edit for fun and leisure. By and by, if you've done that, you've met a few people, you know something about Wikipedia, then you can come up with big ideas. Like, I care about this issue in the world. I want to make sure this issue is well represented in Wikipedia. Is there a community already doing this? No. Well, then maybe I'd like to apply for a grant. Maybe I'd like to collaborate with an existing community. Then these things come on the table. If I had to say what kind of time commitment it is to come to be pretty familiar with Wikipedia, I would say about 40 hours. And I would say it's the same kind of time commitment for getting familiar with YouTube. There's a lot of people, they think I'm going to be a YouTuber, I'm going to be a celebrity. It's not that easy. Like, you got to spend some hours on that website before you know what's going on. And I would say for Twitter, YouTube, Wikipedia, all these websites, 40 hours is about your time commitment to get into this hobby and have some idea of what's going on.
Thank you so much. I really appreciate that. Another question popped up in my head and it just like went. Uh, I see you're muted, so I'm gonna let you. So you go.
No. I just wanted to say thank you. I think that was a comprehensive list, and as you said, a gold mine for anyone who wants, for us, and anyone who comes back to listen to this particular podcast and broadcast. Indeed.
Yeah, thank you so much. I really appreciate you coming on. So that is our show. Like, I don't know. I think that was comprehensive. As
Yes.
usual, I will put Lane's information, if it's okay with him. I'll put Lane's information in the description box for the videos that are shared on visual platforms like YouTube and LinkedIn and Facebook. So if you have any questions, you can reach out to him directly. And
Sure.
also, as usual, if you have any comments, questions, or thoughts about topics that you want to hear, you can email us at truehealthlive@gmail.com, and we'll try to make it happen. So once again, thank you so much, Lane Rasberry, Wikimedia-in-Resident at the School of Data Science at UVA. You were such a wealth of information today, and I appreciate you coming on to share what you know. Give thanks, Yakira Eden, Precious Stepney, for joining us. And that is our show for today, and we will see you in the forward. Peace.
Thank you. Peace.
Thank you. Peace.